My name is Demonte. Today I will be your nurse and I will be assisting in putting a Foley care. The doctor had ordered to put a Foley into you because you are retaining some urine and we're going to release some of that tension that you're feeling in. Can you please verify your name and your birthday? Okay. I'm going to begin by closing the curtain and giving you some privacy. I'm going to wash my hands. And I'm going to get someone to help me put in the Foley with me. We are going to begin by first pulling back the gown and the sheet. At the same time, we still want to keep privacy for our patient. We are going to make the patient in a very comfortable position as much as they can tolerate. We don't want them fully up, and we can want them in almost a supine position, but not a supine position. Again, this all just depends on how comfortable the patient is. Okay. We are going to begin by opening our Foley bag. And disposing of that, and we are going to pull out our Foley kit. We are going to dispose of any unwanted trash. This step is very important. We need to create a sanitized area where we will keep all our material. We do not want to contaminate. So we are going to pinch the outside and we're going to pull this out. Be very, very careful not to touch the inside. Again, we want to keep a very sanitary work area. We're going to pull back the flaps, pinch, and pull. We are going to take our gloves and we are going to take it outside of our sanitary area and we are going to pull it on the side. We are going to begin by taking this blue sheet. This sheet will go under our patient. You want to make sure that the sunny side is facing upward. Now my lovely assistant will help me in lifting my patient's legs. And we're going to place the white shiny side facing upward. Again, you want to try not to touch the inside. Make sure that the white shiny side is facing upward. Then we are going to take our sheet, and this is what we use on the patients. And we will place it in our urethra. And my lovely patient will help me adjust and put it on. Now we are going to begin on putting on our gloves. It is very important that we put this on correctly. We are going to open our gloves. We are going to take the outside flaps and we are going to lift it up, trying not to contaminate. And we're going to pull the flaps out. Then you see a flap, a fold over this glove. That is what we want to use to put on our gloves. So we're going to put our fingers under the flap and we're going to slide in our hand. We do not want to get any contamination. You don't want to touch the inside. And we're going to slide our hand inside. Make sure not to touch the inside. We want to keep it very, very sterile. And then we will do the exact same thing for the other glove. We will find the flap. We will put our fingers underneath the flap and we are going to slide our hand inside. We will not try to touch the inside to contaminate. We want to keep it very sterile. Now we are going to pull apart our kit. We want to keep everything inside. Keep it nice and sterile. We do not want to contaminate. This is a sample that is used to collect urine. This is sent out to the lab to do results to see if they have a urinary tract infection or any other pathogen that we need to find to give them the correct medication. We are not going to use this today, so we are going to put this out on the side away from us. You're going to take your Foley, you can use your pinkies, and we're going to keep it inside, keeping everything as much as possible sterile, free from contamination. You will begin by taking your iodine. This is used to sanitize our labia, and we will sanitize it from going from the clear aortus all the way to the anus. We want to try to stay as much as we can, not contaminating anything. Make sure you don't get any iodine in your gloves. Then we are also going to open our lubricant jelly. This is what we are going to use to lubricate our tube. Now there are very different ways that this can be done. There are some nurses where they like to take the lubricant jelly and they will place it on the tray and they will put the tube and then put it on there. But because I don't want to contaminate anything, I am actually going to put the lube and put it inside my lubricant jelly. So we're going to put that on the side. And we're going to take out our syringe and place it out away from us. Now, you have to know what side you are dominant on. If you are left dominant or right dominant. If you are right hand dominant, that is the hand that you want to use to work all your material and getting it in. And you want to use the hand that is not your dominant, and you are going to place it on the patient. When you place your hand on the patient, you cannot remove it. It has to stay there. This hand has now become contaminated and you cannot remove it. So my lovely assistant will help me by holding the flap down so we can see our patients. We are looking for the meatus, and we are going to begin by pulling back the labia, and we are going to look for the meatus. Now the meatus is usually the one in the middle. You will see 3 holes in a female patient. We will begin by taking our get out. Okay. So we are going to take our iodine. Now I'm going to take my non-dominant hand, and I am now going to place it on my patient, and I'm holding back the labia, and I am looking for the meatus. I can no longer remove this hand. It has to stay here at all times. We are going to take our iodine, pull back the labia, and we're going to clean from the catherider all the way to the anus. You are going to wipe once, and then you are going to discard. You will take another swab, and you would do the exact same thing on the other labia. Make sure you hold it back. We are looking for the meatus, and we're going from the catherider to the anus. Wipe once, then discard. And then we are going to clean in the middle, wipe once, and dispose. We will now begin by using our catheter. And we are going to lubricate. And you want to get 1 to 2 inches and then you are going to use your pinky and you are going to wrap and get your tubes. And we are going to bring this on over to the patient's bed. Now we are looking for the meatus, and we are going to put it in our patient. We don't want to bring any discomfort to our patient and our pain. The patient will let you know if you bring any pain, and we will need to try to be gentle. So we will begin by slowly and gently putting it in the meatus. You want to do this slowly and gently. You don't want to bring any pain to the patient. You're going to put this in to 2 inches. You will take your syringe of solution. We will take off the cap. And we are going to put it, and we are going to create a bubble inside the catheter. You want to make sure you have this in and it is not loose, because then our solution that is inside here will spill. We want to make sure we get that bubble inside our patient. And then we are going to slowly and gently push in our solution, which will create a bubble inside our patient. You don't want to do this fast. We don't want to bring any pain and discomfort to our patient. We need to ask our patient how they are feeling and that they are not feeling any discomfort and pain. Once we are done, we are going to take out our syringe, put it to the side. You will pull the Foley tube out until you feel a nudge. It's going to stop. When you feel it stop, that is the bubble that we had created with the solution. That is how we know we had done it correctly. Once we are finished, we are going to remove all our product from the patient. Get rid of everything. We are going to dispose and throw it in the trash. And we're going to get rid of all our product. We are going to dispose of it in the trash. And we are going to remove our gloves and dispose. And my lovely assistant will help me by bringing down the cover, providing privacy for our patient, and we will adjust the patient in a very comfortable bed position depending how they feel. Mr. Monkey, would you like me to raise your bed in a very comfortable position? We want to make sure that their coli are near if they need anything. Maybe they'll feel some pain and they'll want to tell us, or they'll need to go to a restroom or something. You always want to make sure that your patient is covered, has privacy, that their coli is near, and that they have any items that they may need that is within their reach. That is how you put a Foley in. Now we are going to begin by showing you how to properly remove a Foley when the patient no longer needs it. We got to make sure that we have the order from the doctor We cannot perform this without the doctor's permission and order. Good morning, Mr. Monkey. The doctor has given us an order. We are removing your Foley from you, and I'm going to be your nurse. My name is Maria, and I'm going to help you today. I'm going to begin by putting you in a comfortable position. I'm going to wash my hands. And I'm gonna go get some gloves. Okay, now that I have put on my gloves, we are going to begin by giving some privacy. We are going to close the curtain, and I'm going to pull back your cover and your gown. Oh, and a thing that I had missed in the video. So your Foley always has to be below the bladder of the patient. You do not want to hang this on the bed rail. You want to hang this on the bed frame. This is very important because if you do not place this correctly, it will pull on the patient's Foley tube, and it will be very painful and very, very uncomfortable for the patient. So we're going to put it on the bed frame below the patient's bladder. We are going to get a clean sheet, and we are going to put it underneath our patient's feet. So anything that is leaking from pulling out our Foley is not getting the bed wet and is not getting the patient wet, and will catch all our material. So we are going to begin by making sure that our patient's leg is in a frog's position. And we're going to take the syringe that we had used, make sure it's the same millimeters that we used in the previous Foley. We don't want to get too much out and too much in. So we're going to pull out the solution that we had put in there. So we had originally put in there about 10 millimeters of solution, and we have about 10 millimeters out. Okay. Then we are going to slowly and gently pull out the tube. We do not want to bring any pain or any discomfort to the patient. So you're going to gently pull, 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 pull. As you can see, we no longer have the bubble that was in there that was keeping it from falling out. So we have correctly drained out the bubble, and we had correctly done this procedure. Another thing that I forgot to mention, after you put the Foley on the patient, you want to get a clamp and you want to put it on the patient's leg. This will keep it from dangling, and it will also keep it from clotting up, because sometimes the Foley can go underneath the patient's leg and they put some pressure on there and it will clot the Foley, and it is very painful for the patient. So you want to put the clamp on the patient's leg, and you want to make it where it is not tangling their feet, and we want to put it below the patient's bladder. Once we are done, we are going to dispose of our Foley. And we are going to remove our dirty linen from our patient underneath. And I'm going to get some wipes to provide some perineal care for our patient. Always want to provide perineal care for the patient. And we want to clean. Some patients are able to do it by themselves. Some patients need assistance. We must always ask if they need help, and we must assist the patient. Once we are done performing perineal care, we will close the gown and their blanket, and we will also offer hand hygiene for the patient to wash their hands. Even though they did not perform removing the Foley, we must always ask for the patient if they would like to perform the hygiene. Mr. Monkey, would you like a cloth to wash your hand? And then we are going to dispose. And then we are going to remove our gloves. And we are also going to perform hand hygiene. And we are going to either put hand sanitizer on, or we will properly wash our hands. And that is how you properly insert a Foley and remove a Foley.